To better illustrate how the reamers clean and shape canals, we purposely extend our instrumentation 1 millimeter or so beyond the apical foramen. This is never intentionally done in clinical endodontics, where our goal is to go 0.5 millimeters beyond the constriction through a 25 to the constriction with the 30 and 35, 1 millimeter shorter with the 40, and a 0.5 millimeter extension when using the 2506 reamer. Here you can see I am in the process of negotiating an 06 reamer to the apex of the curved distal root of a lower molar. The 06 reamer finally extends the entire length of the canal, going about 1 millimeter beyond the apical foramen to demonstrate the patency of the entire length of the canal. The manual use of the reamers is replaced by their use in the 30-degree reciprocating handpiece. Please note how easily the reamer goes to full measurement when using the reciprocating handpiece. The 08 and 10 reamers negotiate to a short distance beyond the apical foramen using the reciprocating handpiece as part of the normal sequence. The 15 relieved reamer is placed into the reciprocating handpiece and taken within seconds to about 1 millimeter beyond the confines of the apical foramen. Also, please note how the curve is at least partially recorded by the stainless steel relieved reamer, an advantageous property possessed by stainless steel and not nitide. The 20 relieved reamer is now taken about 1 millimeter beyond the apical foramen using the reciprocating handpiece. We now use the tapered piezo to straighten the coronal curve as well as impart a coronal taper, selectively working the outer walls of the curved canals. Following irrigation, we then shape the canal 1 millimeter beyond the apical foramen to a 25 using the 30-degree reciprocating handpiece. The 30 relieved reamer is then taken to the apical foramen, 1 millimeter shorter than the previous instruments. We are now looking at the apical shape after instrumenting to a 30. The 35 is now taken to length using the reciprocating handpiece. The 35 is generally the last stainless steel relieved reamer to be taken to length. After that, we generally pull back 1 millimeter for the 40, and that is followed by the 2506 nitide relieved reamer. The purpose of this short video is to show canal shaping without distortion. This can be done without pre-bending when the curve being negotiated is one with a long radius, otherwise known as a gradual curve, as opposed to abrupt ones that require pre-bending to first negotiate and then to negotiate without distortion.